Good morning. And today's topic for the session is going to be Exodontia. Good afternoon. Today's the topic for the session is going to be Exodontia. What is Exodontia? According to Jeffrey L. Exodontia or extraction, it is a painless removal of whole tooth or a tooth root with minimal trauma to the investing tissue so that the wound heals unevenly and no post-operative prosthetic problem is created. It's more or less doing the extraction, removing of tooth without damaging to your adjacent tissue. That means you're not damaging to your periosteum and minimal trauma to the investing tissue, and the wound heals by it is naturally. And there is no post-operative entrance to your prosthetic when you're planning for replacement of missing teeth, replacement of your tooth which you're going to extract without damaging to the bone. When do we need for extraction? If the patient has got severe caries, pulpal necrosis, or if the tooth is periodontally compromised, mobile tooth, the tooth which is a line of radiation therapy, the tooth it is line of jaw fracture or fracture teeth, or pathological associated with the tooth for orthodontic purpose, malpositioned teeth, a retained deciduous tooth, extraction due to prosthetic reason or prosthetic hindrance or impacted teeth. Contraindication is divided, we can classify into absolute contraindication, relative contraindication, where in absolute contraindication will not do the extraction if patient is uncontrolled diabetes, leukemia, or patient who's got renal failure, cirrhosis of liver, and cardiac failure. Relative contraindication, nothing of patient who is known for diabetes, which is under control, hypertension, bleeding disorders, pregnancy, cardiac disease, immunocompromised patients, and patient with liver dysfunctions. Local contraindications where your patient has got acute infection, severe cellulitis, pericorditis, and hemangioma. There is two modes of extractions. One is called intraalveolar or otherwise called as closed method. The other method is called transalveolar extraction. It is called open method of extraction. It is intraalveolar method is otherwise we can call this a forceps extraction. Removing a teeth with the use of your forceps or your elevators. Whereas in transalveolar extraction, removing a tooth by dissecting the tooth into half or many off by guttering your bone. This is called open method of extraction or otherwise called transalveolar extraction. Before considering extraction, your surgeon should be always prepared with your neat scrub, with your glove, sterile glove, mask, and your head cap with your goggles. Patient preparation, it should be a sterile disposable towel should be draped across the neck of a patient. Always a surgeon position is still many people will be in dilemma which position we should stand. If you're going to extract first quadrant, second quadrant, and third quadrant, always you should stand next to in 6 to 9 o'clock question. Only for the fourth quadrant of extraction, you'll be standing behind the patient between 9 to 12 o'clock question. One must know before doing extraction is principle of elevators. Principle of elevators, we have three principles: lever principle, wedge principle, and wheel and axle principle. Lever principle is this includes the effort arm, which is the handle. Your fulcrum is nothing about your alveolar bone. The resistant arm, which exerts the pressure of the tooth to come out from outside. Wherever this effort, you will give the effort arm. Fulcrum acts as a bone resistance, which will help the tooth to come out. This is a maximum mechanical advantage is gained by keeping the effort arm longer than the short arm. Short the resistance arm. Best example of lever principle, your state elevator. The second principle is considered wedge principle. This is done by wedging the elevator or your beaks of the forceps between the tooth and your bone on between the pedal spaces. This displays the tooth occlusally, and the instrument can be further pushed into the socket to display the tooth further out occlusally. Then it can be removed completely. The best example of wedge principle is your couplants. You can see here insertion of wedge between the tooth and the root. Your root comes out occlusally. Wheel and axle principle. It is nothing about it. It resembles like a pulley. Your criers and crossbars are the best example for the wheel and axle. When the handle is rotated to the force created on the blade of the elevator and multiplied, creating a greater mechanical advantage to elevate the tooth out of its socket. If you are extracting a lower molar, your one root is taken out, the other root is left inside the bone. You can use a crossbar, engage into a distal root. Once if you do a clockwise rotation, it will engage your mesial root, then it will come out. This works on wheel and axle principle. I wanted to ensure three principles of your elevators. One is wedge, one is lever, and one is a wheel and axle principle. On exam point of view, they can ask you principles of elevators. You must write these three. When it comes to principle of extraction, you should write expansion of bony socket, and with the help of your expansion of bony socket, you are able to remove the tooth outside from the socket. Don't get confusion between your principle elevator and principle extraction. Principle of forceps. Goals of forceps use expansion of bony socket by the use of wedge-shaped beaks of forceps, removal of tooth from the socket. What are the force we usually give during extraction? One is apical force, buccal force, lingual force, rotational force, and tractional force. How do we do? Pushing the patient, administration of local anesthesia, loosening luxation of your soft tissue attachment from the tooth, adaptation of forceps to the tooth, luxation of tooth by forceps, and finally removal of the teeth. One must ensure that adaptation forceps plays a major role when you are luxating tooth. You can see a forceps is engaged below your CJ level as much as you possible. Then your apical force can be given, your buccal or lingual or rotation force has to be given based on which tooth you are going to extract. This highlights the importance where you need to hold up. Always you must ensure the forceps should be held below your CJ level. This is also very important. One must know that when you're holding your forceps with the right hand, your left hand should be in a position. It is used in reflection, protection of other teeth, stabilize your patient's head, supports your alveolar bone, and it also a tactile information for not to luxate the neighboring teeth. Now we have extracted what are the complications you can encounter. Mostly intraoperative complication we can see failure to move the teeth, fracture of the tooth or alveolus, mandible, and maxillary tuberosity. Improper handling leads to mucosal laceration, puncture wounds on gums, lips, tongues, and floor of the mouth. Luxation of adjacent tissue if you're not holding your, if you're not using a state elevator or any luxation properly. Displacement of root into the facial spaces, nerve injury, hemorrhage. Delayed complication, hemorrhage like bleeding, pain, dry socket, post-operative swelling, edema, hematoma, infection, trismus. Late complication can lead to chronic osteomyelitis, osteoradionecrosis, nerve damage, chronic pain, and whereas in systemic complication, patient can go to syncope, hyperglycemia, hyperventilation, fits, myocardial infarction, Addison crisis, respiratory obstruction. What are the post-op extraction care you'll give? Irrigation to the site with saline, removal of tissue tags or granulation tissue from the soft tissue, compress the alveolar bone with the finger pressure, suture if it is necessary or your socket is going to be big, stop the bleeding with a gas bag. Generally, we give instruction to patient bite firmly for gauze for at least for 30 minutes or beyond if it is 1 hour. Not to spit or suck from the promote bleeding. If you keep spitting, your cloth will get disrupted. Patient will end up in dry socket. If bleeding continues, advise the patient to keep your pressure gauze or any cotton into the socket. And not to brush. We tell the patient not to smoke for next 2 to 3 days. Do not touch the extractor side with the brush and tongue, with a brush, tongue, or with the hand. And we tell the patient not to take hot and spicy also. That comes under diet and pain relief. After extraction, we tell the patient to have a semi-solid or liquid diet. Drink more water. Avoid hot food for first 24 hours. Anti-inflammatory analgesic should be preferred. Warm saline rinses, gentle brushing should be advised for the very next day. Thank you.